This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, I have a quick informal medical minute. I've been away from the bedside for a week or two, just not working clinically. And so I haven't had a feel for what's going on in the department. But Travis helped me out. He tells me he has a new model for planning medical minutes, which is to ask somebody in the audience here for an organ system and then ask somebody else for a disease process and then see if I can figure something out on the fly. Point us in one direction. Cardiac. Okay, anyone have a disease process on cardiac side I should talk about? Bradyarrhythmias. Oh, I love Bradyarrhythmias. Okay, I have a simple list for Bradyarrhythmias. So when a patient presents with a heart rate of 40, they're 80 years old, they take several medications, there's a bag of half-empty pill bottles that EMS drops off at the bedside, the patient is awake but looks lethargic and out of it, and their blood pressure is 80, heart rate 40. So there are only a very small number of things that cause this problem. So name them. What is one cause of severe Bradyarrhythmia?
Complete heart block.
Complete heart block. Excellent. So you're correct. This patient is in complete heart block, and you recognize that by a little widening of the QRS and AV dissociation. It can be intrinsic failure of the conduction system, like they're getting old and they need a pacemaker. What's the next thing it can be? Meds. Absolutely. Which meds? Beta blockers. Absolutely. What's the third thing it can be? Hyperk. Yeah. So think intrinsic failure, electrolyte problems, specifically hyperk, meds, beta blockers, and one other thing, just one. Heart attack. There you go. Ischemia. So it's really only four things. When you see somebody with profound bradyarrhythmia, it's one of those four things. That's basically it. It's meds, it's hyperk, it's ischemia, or it's intrinsic pacemaker failure. I'm making an addendum, as Dr. Barlock has pointed out, hypothermia, which is a very important fifth cause of severe Bradyarrhythmia.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.